It's 7 a.m. from Fox 35. This is Good Day Orlando.
Birth control for men could soon become a reality.
Yeah, coming up here on Good Day Orlando, a local doctor explains how it works and if it's a good alternative to the pill. On the Health Watch, birth control is usually thought of as something for women, right? Well, that could soon change. Scientists are now working on a new birth control option for men. Vasogel is designed as an easily reversible alternative to a vasectomy, and clinical trials could begin as early as next year. So we're going to talk more about it. Joining me, Dr. Jamin Brahmbhatt. He's a urologist with the Pure Clinic. He joins us now to talk. Good to see you. Always appreciate you being here.
Thank you.
Hey, I'm glad that, well, let's talk about it first. What exactly is this procedure?
So Vasogel is thought to be an alternative to vasectomies, and it definitely, I think there's definitely a market for this out there. So as a guy, just speaking as a guy, before you're talking about Vasogel, we don't like to talk about male birth control. However, as a men's health expert and an advocate for men's health, I feel there's definitely a need in the market. Women have a million options for birth control, whereas men only have two things, vasectomies and condoms. So I think this is definitely a step in the right direction to get more stuff out there in the market for male birth control.
And this is reversible, right? Because I think a lot of guys run into the situation where they had the vasectomy. Later on they say, well, now I want more kids, and they don't have a good option there.
They do. I mean, an option is always vasectomy reversal, but it can be very costly.
That doesn't always work either, right?
It depends on the surgeon. I mean, it could be up into 90% plus, but there's an added cost to it. So Vasogel and vasectomies basically target the same structure in the body, which is the vas deferens. That is the tube that is responsible for transporting the sperm from the testicle to the ejaculatory ducts. That tube is very small. It's basically the size of spaghetti, 3 to 5 millimeters in width. In vasectomy, we clip that segment. In Vasogel, what they will do is take a polymer, human-made substance, and inject it into that tube. And then that stuff is supposed to basically serve as a filter. So they won't let sperm through, let non-essential fluid through, but not sperm.
So it's just a shot, more or less.
It's just a shot.
Wow.
And theoretically, they have it where you can reverse it. So they have an anti-Vasogel to reverse it. And they've actually done clinical studies in animals here in the States, and they've actually done clinical studies on actually men in India on a similar product. So it's definitely a promising technology, but obviously with all new technology, there's always an added risk and benefit as well.
How effective is this?
Vasogel, we just don't know yet. We know vasectomy is very effective and very cost effective. I'm assuming it'll probably be just the same or similar, but what I'm more worried about is the long-term potential risks, because this is a foreign body that is potentially going to be injected there, and right now in preliminary studies it seems like, okay, it will be reversible. But what if there's a reaction there? What if something happens there where it's not reversible? So there are still a lot of unknowns with this technology.
Okay, so you got the risks there. It's in clinical trials right now, so this isn't something you can go out and do immediately.
No, not yet. Actually,
how long do you think it'll be?
It'll be, I think, at least 3 to 5 years. And you know, vasectomies and vasogels, I mean, they're very quick, cost-effective male forms of birth control. However, there's risk, and there's basically 3 risks I always tell my patients when it comes to vasectomies. 1, it doesn't prevent sexually transmitted diseases. Number 2, there's a risk of failure, which we talked about. And number 3, there's a syndrome called post-vasectomy pain, where 5 to 10% of patients that get vasectomies can have chronic pain in their groin or their testicles after the vasectomy. This is huge, considering over 500,000 vasectomies are done, you know, throughout the country. So there are some added risks, so men need to be aware of these risks, either with the vasectomy or the Vasogel, and I think education is key before they go and get some of these procedures.
Dr. Brahmbhatt, always good to see you. What's your website in case people want to check you out?
Our website is Pure Clinic, or you can find me physically at South Lake Hospital, which is in partnership with Orlando Health, at the Pure Clinic, or you can follow me on Twitter, as you know, at Urologic MD.
You can always find him. All right, thanks, Doc. Good to see you.